So the conversation is coming up a lot right now about why is health insurance so expensive? Why is the cost of healthcare so expensive? And why is it not better? Well, beginning with the health insurance carriers, I'll tell you that the majority of the problem is not the health insurance carriers. If you look at their profitability, after ACA, they were regulated so that 85% of health insurance premiums had to go directly to the cost of paying claims. Only 15% could be retained by the health insurance carrier to use for selling general administrative, which is basically gross profit margin. Part of that is then used for administrative expenses, and part of it would be retained as net profit margin. If you look at their the net profits of these companies, you can Google United Healthcare net profit margin. It's around 6%. Check Anthem net profit margin. It's around 2%. It's far below typical Fortune 500 company net profit margin. By no means would it be considered an excessive net profit margin. So where does the cost of healthcare go if they're not the ones making the majority of the money? Well, again, 85% of the premiums are used to pay claims. That means they're used to pay providers and to pay pharmacy. Now, the health insurance carriers have vertically integrated to purchase their own pharmacy companies, to purchase their own providers. But they don't own the majority of providers or major healthcare systems in the country, and they don't own the majority of PBMs either. And as is reflected in their net profit margins being as low as they are, they're not making that much extra money in those areas. But those areas still are making 85% of health insurance premiums are going to those areas, to providers and to pharmacies. So providers, that means doctors, hospitals, healthcare providers. The majority of that cost is, there's a minority of people that are sick, that have high costs of claims, and that's where the majority of the cost of healthcare goes. And the doctors in the US, make more money than anywhere else in the world. Not to say that that's a good or bad thing, but it's easier to vilify the health insurance carrier than it is to actually vilify the doctor, the provider, the hospital, where the majority of actually the money is going, because again, they're providing a good service for society, but that's where the money is going. Same thing with the health insurance carriers. They're providing a valuable service, but yeah, they're making money from it as well and running a business that is profitable. In regards to claims and denied claims and that challenge, it could be from the health insurance carriers, but it goes beyond that as well, because majority of people have their health insurance through their employers. And if you look at larger employers, being the majority of companies with over 1,000 employees, and outside of California, even many that have over 100 or 200 employees are self-funded. Probably all Fortune 500 or Fortune 1000 companies are self-funded. And when companies are self-funded, the employer, along with the broker and the TPA, are actually designing the plan. They might be using United Healthcare Network or Anthem Network, but they're only using that network for the discounts in it, the providers in that network. But other than that, the health insurance provider, even though it might have their name on the member ID card, isn't doing anything else other than providing the network and the discounts. The actual exclusions on the plan, the formularies, the pharmacy formularies of what's included, what's not included, is all set from the employer along with the TPA and the broker. So it's really more complex, where when you come across problems, whether that be to problems of receiving care or problems of cost in the health insurance, with health insurance, it could be sometimes the challenge could come from the health insurance carrier, but it also could come from an employer. It could come from the broker. It could come from a TPA. It could come from, a number of different areas, and health insurance carriers are only one component of it. And like all the other components of the healthcare system, there's some good and there's some bad, but it's definitely not black and white. And the majority of the reason to costs being what they are, or to things that are reflected from the cost, such as how services are provided or how what's included and what's not included is mostly derived from the cost of claims, which is actually the cost of provider services of the healthcare industry, which is hospitals and doctors, and that's where the majority of the cost goes.